Hi, my name is Janelle Fink. I'm the Director of Radiology here at the Punxsutawney Area Hospital. Today I'll be talking to you about the importance of screening mammography and breast density. Why is getting a yearly mammogram so important? Well, because 1 out of every 8 women will develop invasive breast cancer during the course of their lifetime. During this presentation, we're going to take a look at why breast density is so important and how 3D technology can overcome it. Understanding breast density. The breasts are mainly comprised of fibroglandular and fatty tissue. Fibroglandular tissue includes nodes used for milk production and ligaments. They appear white on the mammogram. The American College of Radiology created breast composition categories to describe mammographic densities. The 4 categories are almost entirely fatty, scattered areas of fibroglandular densities, heterogeneously dense, and extremely dense. If you're wondering, how will I know what my breast density is? Well, after you have a mammogram at our facility, you will receive a letter in the mail with your results. And on that letter, your breast density category will be listed. This is determined by the radiologist. Your healthcare provider will have this information available to them as well. Let's look at some examples of each breast density category. This is an example of fatty breast tissue. Fatty breast tissue makes it easier to see lesions and other changes throughout the breast. This type is common in older women. Here you can see scattered areas of fibroglandular tissue. Here you can see the darker areas that represent fat, and there are some islands of fibroglandular tissue. This example is heterogeneously dense. You can see an increase in the density of the breast tissue. This type of tissue may obscure small masses from being seen. This is an example of extremely dense. Almost the entire breast is comprised of dense tissue. There is very little fat within the breast. This type of tissue can lower the sensitivity of mammography, making it difficult to see lesions within the breast. After looking at those examples, we can see why it is difficult to identify cancers in dense tissue, as the fibroglandular tissue appears white, the same as cancers, and can mask them. Studies have shown that there is an increased risk for patients with dense breast tissue. So what is 3D mammography? Digital breast tomosynthesis is a 3D imaging technology that acquires a series of low-dose projection images of the compressed breast at different angles. The system produces thin slices of the breast, allowing the radiologist to step through the slices 1 millimeter at a time. Unlike a traditional mammogram, the slices separate objects at different heights in the breast, producing a 3-dimensional image. 3D mammography can overcome breast density. Breast cancer has nowhere to hide. So how does 3D mammography work? The X-ray tube moves in an arc across the breast, which takes 3.7 seconds. A series of low-dose images are acquired at different angles. Projection images are reconstructed into 1 millimeter slices. These slices allow the radiologist to see behind overlapping structures for diagnostic confidence. The total dose is approximately the same as one 2D digital mammogram. Here's a picture of the mammography unit that we have here at the Punxsutawney Area Hospital. We started offering 3D mammography in 2015 and continue to offer it to all of our patients. So why 3D mammography? Here's an example of a 2D image. The blue dots represent dense breast tissue, and the pink area is a lesion. With traditional 2D mammography, the tissue and lesion can be superimposed, making it difficult for the radiologist to see. 3D mammography allows the radiologist to look at multiple layers of breast tissue, one layer at a time. It's like flipping through pages of a book. The radiologist is able to evaluate lesions seen and rule out areas that might just be overlapping tissue. So here you can see in the example, the 2D image, the superimposed lesion is hard to see around from the tissue, and the 3D images clearly isolates that lesion. Here is an example of a 2D mammogram image of a suspicious area. The lesion is hidden within the breast tissue. Here's an example. Here we have a 2D image on the left and 3D on the right. You can see the difference in how the lesion stands out on the 3D images, making it more visible to the radiologist. Here's another example. On the left, we have a dense breast with a lesion that is hidden. When imaged under 3D mammography, the lesion stands out easily for the radiologist to see. You can tell that this is a suspicious area based on its characteristics. It is large in size and has a spiculated appearance. Here at the Punxsutawney Area Hospital, we are dedicated to providing our patients with the highest quality of care. Our mammography staff is dedicated, experienced, and committed to patient care and comfort. We offer 3D mammography to all of our patients. So please call to get scheduled for your yearly mammogram. Our hours of operation include Monday through Friday, 7 a.m. to 3 p.m. And we have appointments available in the month of October.